What if we've been framing type 2 diabetes wrong? What if high blood sugar isn't the disease, but the late stage symptom? Today, we're reframing type 2 diabetes to its root cause. Welcome back to the Evo Code. I'm Dr. Tom Schiller. Quick disclaimer, this episode is educational only and not for personal advice. If you have diabetes or take glucose-lowering medications, especially insulin, any changes should be done under your medical supervision. Now, let's go upstream. Type 2 diabetes is not a separate disease. It's a late-stage expression of metabolic syndrome. And metabolic syndrome is a disease of chronic energy overload. For years, often decades, the process is silent. It begins with excess consumption of sugar in all forms, refined carbohydrates, highly starchy foods, ultra-processed foods, industrial seed oils. That constant energy input drives sustained insulin demand. Insulin rises first, not glucose. As insulin remains elevated, we begin to see increasing visceral fat, rising triglycerides, declining HDL, subtle elevations in blood pressure. But glucose often remains normal. Why? Because the pancreas compensates. Beta cells work overtime, producing more and more insulin to overcome resistance. This is compensated insulin resistance, and it can persist for years. Then comes the tipping point. The pancreas can no longer keep up with the demand. Insulin output becomes insufficient relative to resistance. Now glucose rises. Now A1C rises. Now we label it type 2 diabetes. But nothing new has suddenly appeared. The dysfunction was there all along. Type 2 diabetes is simply when compensation fails. For decades, we focused almost entirely on glucose and A1C. Tight glucose control improves microvascular outcomes, eyes, kidneys, neuropathy. But it has limited and inconsistent impact on cardiovascular mortality when hyperinsulinemia and visceral adiposity persist. Lowering glucose without lowering insulin does not correct the upstream problem. Glucose is the marker. Insulin is the mechanism. Energy overload is the cause. Most guidelines do not routinely recommend measuring fasting insulin. There are practical reasons: assay variability, lack of standardized cutoffs, uncertainty about treatment implications. But insulin often rises years before glucose does. If insulin is the hormone driving the disease process, it's reasonable to ask whether measuring it earlier might identify risk sooner. This isn't about criticizing medicine. It's about aligning measurement with mechanism. We were taught that type 2 diabetes is chronic and progressive. That's not universally true. This is not primarily pancreatic destruction. It is metabolic overload driven by chronically elevated insulin. When insulin demand decreases through appropriate bioevolutionary eating and lifestyle, insulin levels fall. As insulin falls, the liver begins clearing stored fat. Visceral fat decreases, insulin sensitivity improves, pancreatic workload declines. Glucose control improves because the upstream pressure has been removed. That is physiology. Reversal focuses on lowering insulin demand. Eliminate added sugars. Substantially reduce refined and highly starchy carbohydrates, including rice, potatoes, bread, and pasta. Remove ultra-processed foods. Eliminate industrial seed oils. Prioritize high-quality protein. Build skeletal muscle. Create structured periods where insulin can fall. When insulin demand drops, metabolic flexibility returns. And when flexibility returns, glucose regulation stabilizes. Type 2 diabetes is not simply a sugar disease. It is the final stage of metabolic syndrome the moment pancreatic compensation runs out. But when we lower insulin demand, we lower metabolic stress. And when metabolic stress decreases, the body remembers how to regulate itself. The root cause isn't high glucose. The root cause is chronically elevated insulin. That's the reframe. For a deeper dive, including fasting insulin, triglyceride to HDL ratio, ALT, and waist to height ratio, see chapter 22.2 in the Evo Code. If this reframed diabetes for you, share it. Because the epidemic isn't about glucose, it's about energy flow. This is Dr. Tom Schiller, and this is the Evo Code.